But first, a warning that the next story contains distressing themes of abuse. Today I'm joined by a nurse and an abuse survivor, Karen Danson. Now, when working at the County Durham and Darlington NHS Foundation Trust, she says that she had to beg her bosses not to let her male-born nurse, identifying as a woman, use their changing rooms, so the female changing rooms. Karen was abused by her father as a child, and this brought back traumas relating to years of abuse. Now, Karen and other Darlington nurses have launched a discrimination claim against their employees. This claim is still progressing, notwithstanding the recent Supreme Court judgment. So joining me now, Karen Danson. Karen, thank you so much for joining me. It's really good to talk to you, and you're very brave to be open and honest about what's happening to you, because, as you know, you can get a lot of backlash for just exposing what is happening to you. So can you take us back a little bit to what happened to you as a child, to give us an idea of why you were so nervous about this individual entering a female-only space?
Yeah, so I was sexually abused by my dad when I was a child. It started when I was 6 years old, and it was like 3 times a week, every week for 6 years. Within that period, there was like some horrific things that I actually did, which I obviously don't want to say like on TV, but it left me with PTSD. I would self-harm and things like that because I didn't want to live anymore. And then, like I say, here I am as an adult, as a nurse trying to give back to people. And I walk into work, and one day after shift, and there's a man in my changing room, you know, and I didn't know how to react. I thought I was in the wrong place. I thought I'd maybe walked into the wrong changing room. He's there half dressed. As I'm walking down to my locker, you know, he's saying to me, "Are you not getting changed yet?" And I was like, "No." And then he asked me again, and I started panicking, thinking, you know, why is he asking me if I want to get changed? Is he wanting to provoke a reaction? Does he actually want me to get changed in front of him? And then when he asked me a third time, "Are you not getting changed yet?" That was it. I needed to leave. I needed to get out of there. It just reminded me so much of the trauma that I'd experienced with my dad. You know, my dad would say, "You're not getting ready for bed yet. You need to get ready for bed." And there's this man in the changing room saying, "You're not getting changed yet."
And of course, this is your story, so this is your version of events. So I'm not discrediting it at all, but I'm making it clear that we don't have the full other side of the story, so we have to make that clear. Now, of course, this man in the changing rooms was identifying as a woman.
He was, yes. There's I didn't know at the time, but there's a policy in our trust, a transitioning in the workplace policy, and all you need to do is self-identify as a male or a female, and you would get into that specific changing room. And this individual just self-ID'd as a woman, and he was allowed access into that changing room. And 26 of us got together, you know, we were concerned. We wrote a letter to HR about our concerns, and they basically told us we needed to be more educated, broaden our mindset. They backed this person 110%. And after that, they moved us into a little office, our manager's old office, and we were basically ostracised into there. And this person still gets to use the big changing room.
Well, I mean, sounds a little bit ridiculous that the person who is actually male, with all the male parts, should be allowed to be in a female-only space. Of course, they're not here to defend themselves. So, and there is also no suggestion that they have done anything. You know, they've not done anything abusive towards you in any real respect, apart from the fact that you feel uncomfortable with somebody who is clearly male. Sharing a female-only space, despite the Supreme Court ruling. Why have they not responded or made sure that now female-only spaces are based on biology?
I would like to know the answer to that question myself. I really don't understand why they're siding with this one individual over the concerns of myself and 26 other girls. I mean, there could be other people in that changing room who are going through trauma or who have experienced things that they're just too afraid to come forward. And if it wasn't for the policy, he wouldn't have been in the changing room in the first place.
You were also told that a trans woman, so a biological man, had to be present for your gynecological sort of examination.
It's my surgery. It's this same individual who I was in the changing room with.
Yeah.
I was due to have a gynecology surgery, and it was like part robotic, and this person works in that theatre. And I said to theatres, I really, because of the lawsuit and things, there's a conflict of interest. It's really ethically inappropriate to have this individual in there. And their response was, well, how would he feel if we moved him out? It's not possible. Do you know what? We'll cancel your surgery. We'll move you to a different hospital with a different doctor at an unknown date.
But are you okay with a man being present or doing your surgery? Because obviously this individual, whilst they identify as female, are actually male. So if a male were there doing your surgery or being there or present, would you be okay with that?
I think it comes down to the fact of like what actually happened in the changing room and how he'd pestered me to get changed. I just thought it was completely inappropriate to have him in that procedure, right? Like it's an intimate procedure right next to the surgeon, passing things to the doctor, really. I just didn't think it was appropriate.
And the response was simply to cancel your appointment and move you somewhere else.
That seems an unknown date.
That seems absurd when all they would have had to do is just say, look, this person doesn't feel comfortable with you being there for certain reasons. They've had certain experiences in their life where this makes them feel uncomfortable. Would you mind not being there? I don't see why they didn't just do that instead of try and make things awkward for you.
Exactly. I mean, they did that in the end because I complained and I contacted like the legal team and the patient experience team, and they did actually have him moved out from my procedure. So it was possible. It just goes to show how far the trust are willing to go for this trans ideology, for the feelings of one person.
Now, of course,
they didn't treat me as a patient or anything. Just, I think it felt like punishment because I was part of this legal case.
Now, of course, there's nobody here from the trust to sort of talk us through why they felt that it was important to prioritise the needs of somebody who'd be observing or being part of an operation rather than the person who's having the operation, because to me that doesn't really make any sense. Did you, were you accused of being transphobic and all the sort of usual backlash that you would get for standing up for what you feel is right for you?
I was with the theatre team, with the theatre manager. I was made to feel that I was transphobic because I didn't want this person in there. And I said, given what had happened to me as a child, I'd want as few men in there as possible. You know, we work in that, like with working in the hospital, you do sometimes, like you get to know the team, you get to know everybody, and you can say, look, do you know what, I'm having a procedure, I really would like you to be involved. But I wasn't given the chance of saying, well, actually, I don't want this male in there. I wasn't given the opportunity for that because they just refused it outright.
So, Karen, where are we with things now?
In regards to
the whole situation, yes.
Trust.
Yeah.
They're still dragging their feet. We've heard nothing at all. And like, given the Supreme Court judgment, I would have presumed that things would be put in place. It's there in black and white now, but they're still dragging their feet. We've not heard anything. And like I say, I met Wes Street in last October, and he promised that he would do things. And you know, here we are 6 months later, and he's still not done anything.
It just seems so. It just seems so absurd that, you know, for me, a man is a man, a woman is a woman. There's no way of getting around that. If somebody wants to dress up in women's clothes and say they are men, that is fine. But if you don't feel comfortable with somebody being like this, being around whilst you're having an intimate operation, I don't see what the problem is. You should just say, fair enough, you're entitled to that. Given your background, I don't see why they need to make such a big deal about it. But what I do really object to is males being in female-only spaces. I really do find that, you know, the whole reason why these spaces are separated is because women are actually the most vulnerable of the sexes. Even if you're a man identifying as a woman, you're not a woman. So the person is still a woman and they're still very, very vulnerable. And it's because men are stronger than women. It's not a suggestion that this person's going to do anything bad, but to protect women, we have female-only spaces. Why do you think that they struggle to acknowledge this? I
honestly don't know. I don't understand. It's happening everywhere. It's happening in hospitals and trusts and in places where you go and try on your clothes and things. There's all these different changing rooms, and it just seems to be getting more and more out of control. And it's just like, what's going to happen? Is it going to take someone to actually be physically attacked before people do something about it?
Yeah, well,
and that's why I've came forward to lift this anonymity, to help other people to find the courage and strength to come forward and say, do you know what, silence isn't the only answer. let's not be defined by what happened. Let's step forward, and hopefully other people have the strength to do the same.
All right, Karen, listen, it's really good to talk to you. Thank you for being so brave and speaking out. Again, there's no indication that this person has done anything that is offensive or abusive. It's just simply your feelings as to how you wish to be treated in your female-only space, and you want it to stay that way. Karen Danson, thank you very much. It's really good to talk to you. Very brave of her. Well, listen, a spokesperson for County Durham and Darlington NHS Foundation Trust said, "We want all our colleagues and patients to feel safe, respected and supported at work, and in our care. We are very sorry when this is not the experience. We are committed to providing a safe, compassionate environment for all patients and staff." OK.